Parkinson's disease, PD, is a chronic and progressive neurodegenerative disease, with patients typically suffering motor symptoms of rigidity, tremor, and bradykinesia, resulting in severe disability. PD is mainly characterized by the loss of dopamine neurons in the substantia nigra. The initial cause of PD remains unknown, but is believed to involve a number of genetic and environmental factors. Chronic loss of dopamine neurons results in the depletion of the neurotransmitter dopamine and can impact other neurotransmitter systems throughout the body, with consequences differing for each patient. Administration of the dopamine precursor levodopa, or L-DOPA, is currently the most effective treatment for PD. L-DOPA can be administered orally and crosses the blood-brain barrier, whereas dopamine cannot. Within neurons, L-DOPA is converted by the enzyme dopa decarboxylase, DDC, into dopamine. This allows an increased release of dopamine from nerve terminals for symptomatic relief of PD. Unfortunately, L-DOPA is largely metabolized by DDC present in the periphery. When administered alone, only 1% of L-DOPA actually reaches the brain. By administering L-DOPA alongside a DDC inhibitor, more L-DOPA can be preserved for metabolism within the brain. However, even with a DDC inhibitor, only 10% of L-DOPA reaches the brain. Rapid and extensive L-DOPA metabolism also occurs in peripheral tissues via the enzyme catechol-O-methyltransferase, or COMT, causing intermittent stimulation of central dopamine receptors. As such, most patients receiving long-term treatment will develop fluctuations in response to L-DOPA, and again experience loss of motor control. Bial have developed Ongentys, opicapone, a novel third-generation COMT inhibitor. Ongentys is designed to provide potent and long-lasting COMT inhibition for patients treated with L-DOPA experiencing motor fluctuations. Inhibition of COMT-mediated metabolism can increase the availability of L-DOPA, leading to sustained and stable dopamine levels and decreased peak-trough variations. Ongentys is a potent, purely peripheral COMT inhibitor that selectively and reversibly inhibits COMT with a high binding affinity that translates into a long duration of action. This allows Ongentys to be administered once daily, which is proven to be effective at reducing off and increasing on time, without increasing the duration of on-time period with troublesome dyskinesia. The efficacy and safety of Ongentys has been demonstrated in 2 randomized phase 3 studies in over 1,000 adult PD patients and has not been associated with hepatotoxicity seen with other COMT inhibitors. Ongentys provides stable COMT inhibition to increase L-DOPA plasma levels, with bioavailability improved by 24% versus entacapone and by 55% versus other levodopa formulations alone, thereby enhancing the clinical response in PD patients. Ongentys will allow physicians to individually tailor existing L-DOPA regimens. It is often necessary to adjust levodopa dosage within the first days to first weeks after initiating the treatment with Ongentys. Bial is committed to finding and developing new drugs to treat diseases of the nervous system and provide a better quality of life for patients.